Recently, the term Deep Plane Facelift has been mentioned quite a lot, and I would really appreciate it if you could explain it to us. What is the Deep Plane Facelift technique?
All of that has a history, Facial rejuvenation surgery has been done for many years. Over the years, many scientists have contributed valuable insights on how exactly to go about rejuvenating ourselves. So, I vividly recall that from the time I graduated as a plastic surgeon, these specific techniques already existed. Generally, improving the visible signs of aging involves some form of traction on a crucial underlying tissue found beneath the skin. This tissue is known as the SMAS, which stands for the superficial musculoponeurotic system, or more precisely the deep musculoponeurotic system. So the various techniques either pull on that underlying tissue, a process often referred to as plication, or they meticulously lift and secure it further back, essentially repositioning it to achieve the desired tightening effect by way of tensioning it. That's what's referred to as the deep plane. However, it remains quite controversial. If you interview plastic surgeons around the world, you'll discover that there are surgeons who perform one technique or the other, and both groups confidently speak of their successful outcomes. In other words, there hasn't been a specific circumstance or a definitive study that has convincingly established one technique as unequivocally superior to another. Perhaps it's the surgeon themselves who adapts better to the procedure, feels more comfortable performing it, and in their capable hands achieves the best possible outcome.
Okay, so what's your favorite? Which one do you prefer?
Well, I have performed all the techniques. However, over the years, the technique that I've stuck with has been SMAS plication. I frequently employ the technique known as the MAC lift, which involves plicating the SMAS with two internal suture loops, effectively causing the platysma, the muscle located in the neck, to beautifully tighten. And also the muscles near the nasolabial fold are addressed, significantly improving those lines. However, it's not solely about that. In other words, it's not merely about employing a technique that will pull the tissues beneath the skin. Instead, there are other crucial insights that have progressively come to light throughout the years. Interestingly enough, we've come to realize certain things. Because if you were to observe a young individual, someone in their 20s and 30s, in the second decade of life, they possess a significant amount of volume, correct? And that very volume is something one eventually loses.
Right.
So volume is lost around the eyes, and volume is lost in the mid-face. It's crucial to recognize, as we have observed, that one significant aspect of the aging process is the gradual loss of facial volume. Consequently, that lost volume must be restored. Therefore, fat injections into the face have become extremely vital because they provide that desired contour, that crucial volume restoration, whether it's around the delicate eye area, in the lower eyelids, the prominent malar region, or even the piriform fossa area, effectively lifting the nose, as the nose typically gets reabsorbed because of the bone underneath it, which is the piriform fossa. So the nose also tends to sink a little, which creates the appearance of greater aging. Therefore, replenishing the face with fat at the time of facelift surgery will yield significant results. It's truly something that offers considerable additional benefits.
It's like creating a perfect combination of various elements. The facelift.
Yes.
With the fat transfer procedure.
I mean, there are always various procedures that one can incorporate into a facelift, which are really going to provide numerous benefits. Almost always strive to incorporate these added benefits. For example, you're going to first analyze the patient because not everyone experiences aging in the same way.
Is it?
We don't perform the same surgery on every patient.
Okay.
So it's important to see what I'm going to address, what I'm going to improve, right? So I can do the facelift or the mini facelift, as they say, right? Whether it's with that plication from the MACS lift, and I can also add fat around the eyes in the piriform fossa. The lower eyelid can also have its corner gently pulled, specifically targeting the outer canthus. That's known as a cantotomy, a surgical procedure to secure or fix it right here. And that also provides a more youthful look because usually, as time passes, the eyelid also tends to become a bit more saggy. That needs to be tightened a bit, and it gives a more youthful appearance again. Right? Just one example, we could also perform the facelift procedure and in addition, incorporate a laser treatment too. Yes, because many people, besides wrinkles and volume loss, also experience sun damage, those changes from sunlight that lead to aging. So, a laser treatment could certainly help improve that as well.
Okay, and so Doc, what age or what age range is optimal for getting a facelift?
Yes, it's variable, but generally, the majority of individuals seeking a facelift are typically found to be in their mid-40s to mid-50s. That's generally the age range for the procedure. Typically before that, people opt for non-surgical treatments like Botox, fillers, and such. However, there comes a time when those non-surgical procedures no longer give you that benefit, the one that a facelift will give you.
Okay, the difference between the deep plane and the traditional facelift has become abundantly clear to me now. Thank you very much. The most important thing is for people to be well informed, to get the right information when making a decision, and to consult with a specialist.